Good afternoon, everyone. It's a pleasure to have you with us today on this beautiful Sabbath afternoon as we continue in our series of health presentations, and we're so glad that you could join us today. And so before we get underway, we just want to have prayer, and then I'll turn it over to Dr. DeLisser, our first elder of the Mount Holly Seventh-day Adventist Church, and I'll let him introduce our panel guest today. Let's pray. Eternal Father, we're grateful for this opportunity to join together on this platform as we share in the experiences of health and learn from our presenters on how we can better care for these great vessels that you paid for at a great price. And so I pray that you would be with each of our presenters, give them clarity of mind and thought in their presentations. And may we have attentive ears that will glory in that which we learn today and give you the praise. We ask this in the precious and worthy name of our Lord and Savior, Jesus Christ. Amen.
Amen. Amen. I want to welcome all of you again for joining us for our continuing health symposium series. Over the last several months, we've been focusing on chronic health issues that are intimately tied to lifestyle. We've talked about hypertension, we've talked about diabetes and hyperlipidemia. And in all of those presentations, issues of weight and obesity figured significantly as a risk factor. Because of that, we wanted today to focus on weight gain, weight loss, and how we individually can manage that aspect of our health so that we can promote our overall well-being and health. And so today we're really pleased to have three experts with us. Two of them have been with us before. Jermaine Clark from Wilt Thou Be Made Whole Ministries, who is a health educator and a lifestyle coach, who also does training around those issues as well as being a medical missionary. Glad to have Jermaine again with us. We're also pleased to have again Jane Aswari. Jane is an integrative health coach at the Center for Metabolic Healing, a division of the Chung Institute of Integrative Medicine. And she works with individuals suffering from various metabolic diseases to heal the body from within through nutritional therapies. And joining us for the first time, however, is Dr. Camille Semple Daly, who completed her undergraduate studies at Cornell University and received her medical degree from the University of Medicine and Dentistry of New Jersey School of Medicine, which is now Rowan School of Medicine. She started Access Women's Health, OBGYN, in 2004, where she pursued OBGYN care as a solo practitioner. Although she no longer practices obstetrics, compassionate gynecology care remains her focus. In 2005, Dr. Semple Daly opened Replenish Center to address and restore hormone deficits, which lead to debilitating menopausal and andropause symptoms experienced worldwide by millions of women and men, respectively. She says getting to the root cause of these and other hormone and metabolic imbalances using an integrative functional approach continues to be her primary focus. So we're really glad to have our three guest experts here today. And you'll see that through their presentations that there are potentially various approaches for addressing issues of weight, losing it, keeping it off, preventing it from, increasing. And so we're going to begin with Dr. Semple Daly, followed by Jane Aswari, and then Jermaine Clark. After their presentations, we'll open things up to the audience for questions. We want to encourage you to use the raise your hand function, and then we will open, Pastor or I will open up your mic, unmute you, and allow you to ask a question. Or if not, then you can put it in the chat, and we'll also respond to your questions that way as well. So with that, we're going to begin with Dr. Sepulveda. And Jane, why don't you share your screen, and then Dr. Daly, it's yours.
Thank you so much, Elder Delissa, Dr. Delissa, and thank you so much for inviting me to the symposium. I'm very excited to be here because this is my passion. And I know this talk is entitled Nutrition for Healthy Living, but it should be healthy lifestyle for overall health and wellness should be the main focus that I'm going to present today. Next slide, please. And I apologize that I have a little technical issue, so Jane will be switching my slides for me. I appreciate that, Jane.
Sorry, for some reason it's not.
That's okay.
Forwarding.
My,
oh, maybe I have to hit this instead. Okay, sorry, I have to do it differently for this. Okay.
Oh, okay, thank you so much. So as Dr. Delissa said, my first, I knew when I was 12 years old, I was going to deliver babies and take care of women. And I did that. I didn't waver all the way through medical school. But once I got to practicing OBGYN, I realized that there was a deficit in our medical system where the management of women's hormone and men's hormone imbalances were concerned. So a dear friend of mine, Dr. Howard Young, invited me to learn about bioidentical hormone restoration therapy. And that, for the most part, is what I do. But then it occurred to me that, well, women should not be needing replacement. I mean, we do it safely, we do it effectively, but why do they need it in the first place? And why in other countries don't they need it? And that led us to looking into the lifestyle of the Western Hemisphere and realizing that that was leading to the major unbalance. We also do aesthetic medicine also in our practice. Next slide, please. So this was the first baby I delivered for my practice. She is now 17 years old. And like I said, I no longer do obstetrics, but I still do some gynecology. Next slide. So to start, I'm going to talk about the definition of obesity, look at the obesity trends in the United States, the consequences of being overweight and obese, and then talk about a balanced nutritional approach to maintaining weight. I'm sorry, I lost the screen. But next slide, maybe it will pop back up.
Do you see it?
I do not. I see.
Does anyone see the slides?
Yeah, I see it.
Okay.
I'm sorry, I touched my
Neil?
screen, you know. I apologize. No, I'm not seeing it at all. Oh, I'm so sorry.
I think if you click back to the Zoom page, because I'm sharing it, you should see it if you get back on Zoom, like as, open up Zoom.
I'm not, but I'm gonna go ahead and just pull it up on my phone, and I'll tell you to switch, and we'll be on the same page, I'm sure. Okay, I apologize.
Okay.
Oh boy. I know it's on my end. I apologize.
That's okay.
Okay.
I'm on the slide that says defining obesity.
Okay. It's coming.
Okay.
Okay. Okay, defining obesity and assessing risk. Is that the one you're on?
Yes, yes.
Okay, so the definition of I mean, when we talk about obesity, we're talking about having a high amount of body fat in relation to lean body mass. And the way that we numerically look at that is looking at a body mass index. And a body mass index of 30 or higher is considered obese. So to calculate the body mass index, next slide, it's the weight in kilograms divided by the height in meters squared. Now, immediately, I have a problem with that. That is metric. I don't do that. And the other issue that I have is that I consider high-level math, which I do not do. So the next slide shows a very easy way that you can see or calculate your body mass index.
Next.
Okay, and that is the BMI chart. So you just go down the side and you find your height, and then you go across and you find your weight, and you come down on where those intersect. That is your body mass index number. So if you are in the blue area, that is considered underweight. Green is healthy or normal body mass index. Yellow is overweight, orange is obese, and red is extremely obese. All right, next slide. But there are, of course, limitations to the body mass index. It does not take into account lean body mass. So for instance, if you look at Arnold Schwarzenegger, when he was in his heyday, Mr. Olympia, he was 6'2", 235 pounds. If you plot him on that chart, he would have a BMI of 31 and he would be considered obese. Next slide. And as you can see, Arnold was not obese, okay? Because muscle is heavier than fat. So if you put someone who is very muscular, you plot them on a BMI chart, they're going to appear obese. So that's a limitation. Another limitation is it doesn't tell you where the fat is distributed on a person. And the distribution of fat is very important when we're considering needless pain and suffering, chronic diseases, and also when we're considering an increased risk of premature death. So another way to look at it is waist circumference. And when you're looking at waist circumference, just the bottom line, a woman with a waist circumference greater than 35 centimeters is considered at high risk of high blood pressure, diabetes, and cardiovascular disease. And then when you look at a man with a waist circumference greater than 40 centimeters, that puts him at increased risk. Next slide. Even though we're not going to talk today about underweight, I just want to emphasize that being underweight is not healthy. Okay, we talk a lot about being overweight because that is a major problem in the Western Hemisphere, but being underweight is also an increased risk of pain and suffering and needless death. So if you, the next slide, if you look at that BMI chart, if you're in the blue, you know, when you plot yourself, then you would be considered underweight. So the next slide, we're going to look at a few maps of how obesity has been trending in the United States. And these are maps put out by the CDC. Now, the CDC, the next slide, which will be the first map, the CDC has been putting out these maps every year from 1985, trending obesity in the United States. So in 1985, we really didn't have much data. All of the areas in white are areas where we don't have any data on the obesity trends in those states. But the light blue, less than 10% of those populations are obese. In the dark blue, 10 to 15% of those people are obese. Next slide. We're going to go fast through these slides. Okay. This is 1990, 5 years later. Again, the darker blue areas, 10 to 15% of that population is obese. The next slide, 1995, the darker blue areas, 15 to 19% of the population is now obese in those areas. Next slide. 1997, you see how quickly we're going now. Before we didn't have data, and now we're having data and we're seeing this exponential growth of the country. The yellow areas, you could say a fifth of the population in those yellow areas are obese. Next slide, 2000, a fifth of the population in those yellow areas are obese. The dark orange is now a quarter of that population is obese. That's 2001. And 2004, again, the dark orange, a quarter of the population is obese. 2005, we're now in that dark red area, which is Mississippi, Alabama, and West Virginia. A third of the population, greater than a third of the population there is obese. And here we are at 2010. In those dark areas, greater than a third of the population is obese. So the color kind of changes now, but we're still looking at the same issues. In 2020, this is the map of 2020. This is looking at all of the United States in 2020, and they're eventually going to break it out in terms of race. So in 2020, that dark orange area, you're looking at, I have to zoom on my camera, 35 to 40% of the population there is obese. Okay, I'm sorry, now I gotta switch slides. Sorry, go back to presentations. I'm sorry, I lost my presentation again. Okay. Now the next slide, the green and white slide, that is Asian America, and doesn't look as bad as what the map is about to look like. Less than 20% obese in those states. This is Caucasian America. The next map is Hispanic America. And you see in Indiana and Michigan up there, that's greater than 40%, almost half the population of Hispanics in those areas are obese. And the last one should give us pause, that is African America. Greater than 40%, almost 50% of the population in those states are obese. This is not overweight. This is body mass index greater than 30. So when we look at that map, we have to understand that a couple of things have happened where the culture is concerned. Obesity is somewhat becoming a cultural norm. And normal and healthy body mass index feels out of place. In fact, when I tell people, I show them where there should be in terms of their body mass index, they recoil. I don't want to be that skinny. I said, no, that's normal. That's not skinny. But if you don't want to be that slender, then that's okay. But just make sure that the majority of what you are is muscle and not fat, because it's the increase in fat that puts you at risk. So the next slide, the consequences of the growing trend in the United States is high blood pressure, high cholesterol, type 2 diabetes, heart disease, stroke, cancers, increased maternal and fetal mortality. I'm going to pause right here because this means that mothers who are pregnant and babies who are born are dying before their first birthday. That's what maternal and fetal mortality are looking at. And of course, increased gallbladder and osteoarthritis. Again, looking at that map, and I'm going to concentrate on the map of the African American obesity trend. The next slide, which should be purple, is looking at stroke hospitalization in 2017 to 2019. You see how much that mirrors that previous map of African American obesity. The next map is looking at heart disease hospitalizations. Again, you see how it mirrors that previous map. And the next couple of maps, you could go pretty fast through those, 2004, 2009, 2014, and 2019, that's looking at the diabetes trend. And you see how much that mirrors the obesity trend. And again, that last map of the African American obesity trend in the United States. So what are we doing wrong? Because this problem, I mean, if you think about from when we started, I think it was 2018, 1985 to now, that's a very short period of time for this level of exponential growth. And when you consider that 50% of women are dieting at any given time, 90% of teenagers are dieting regularly, and 75% of Americans believe that they are eating healthy, something is amiss. And there's a lot of confusion. Next slide. There's a lot of confusion about what constitutes healthy nutrition. Should we be doing, and Jane is going to talk a lot more about this than I will, okay? Should we be doing low carb, no carb, paleo, fat? What should we do about fat? Low fat, no fat? Should we be doing Atkins? What protein should we be eating? What type of protein should we be eating? Alkaline versus acidic, organic, intermittent fasting, lectins. I mean, there's a lot of confusion right now, and people are latching onto these trends right now. And unfortunately, it's not working. Clearly, it's not working. And I highlighted intermittent fasting on this slide because that's something that I'm going to talk about, if not now, during the question and answer. So at Replenish Center, the next slide, our approach to healthy living, not just healthy eating, is when a patient initially comes to us, there's an extensive blood work panel that we do. Our consultation initially takes over 2 hours. We're delving deeply into your personal history, your family history, your symptoms, your nutritional history, your current habits, your medications and your supplements. We have patients bring in all of their supplements. They're usually walking with 2 big shopping bags full of supplements. And then it's about educating you on the normal physiology of how your body should be working and the consequences of certain lifestyle choices and how it impacts that normal physiology and becomes pathology. The word physician means to teach. What we're supposed to be doing is teaching you about how to avoid the likes of us in the future, but most of all, how to take charge of your health. And then we come up with an individualized plan to help you take charge of your health. The next slide, we address, we correct, we replace, we restore, we support. There's a lot that we have to do besides nutrition to get a person back into balance. And I'm not going to go into all of that right now in the interest of time. Next slide. But I know Elder Clark is going to address this in his pillars of health. We have to address stress, regular exercise, adequate uninterrupted sleep, sunshine, water, stopping bad habits, smoking, alcohol, drugs. One of the things that is usually not addressed, and I admit by us physicians, is adverse childhood events that have a very huge impact on weight and also chronic diseases and past trauma. And that we also have to help them along with a professional to address. But when we do our individualized plan, we start with when, what, where, why, how, and how much you eat. We're not going to go into all of that today. The main thing I want to focus on today, though, is the when, because the timing of eating is so important for a lot of lifestyle issues and chronic diseases. So my first question to patients after they tell me all about their history and everything is, do you eat breakfast? And they have to pause and say, I say, stop, time out. You don't. If you have to think about it, you don't eat breakfast. At least it's not a regular habit for you. And 31 million Americans skip breakfast every day. And 7 to 20% of children 4 to 18 years old skip lunch. And this is not skipping because of poverty or they cannot afford to. This is the choice to skip breakfast. Skipping breakfast, and it goes beyond the wonderful saying that we have, eat breakfast like a king, lunch like a prince, dinner like a pauper. That sounds good and fine, but there's reason that we say that because of the consequences of not doing it. So I see in my practice, because I do a lot of hormone imbalancing, that not eating breakfast in a timely fashion leads to hormone imbalance, increased diabetes, high cholesterol, high blood pressure. It leads to overeating later in the day, weight gain, negative impact on mood, lower energy levels. It affects cognitive function. It causes headaches and migraines, and it increases insomnia and interrupted sleep. I'm sorry, Jen, I haven't been saying switch slides. Are you on the consequences?
I am. I'm just sort of like catching up. Yeah.
I'm so
when I hear you start to
sorry.
talk about something else, I just move on. Yeah, go ahead.
I'm going to try again. I'm switching
okay.
it on my phone, so I'm sorry, paying attention.
It's okay.
The other thing that I pay attention to when it comes to the patients is, some patients say, oh, yes, I eat breakfast. And then my question to them is, when do you wake up? 5:30. When do you eat breakfast? 10:30. That's lunch. Okay. Breakfast means that you are eating within an hour to 2 hours of waking up. Lunch is 4 to 5 hours after that. Dinner is 4 to 5 hours after that. And we talk about the proportions that you should be eating in terms of percentages, breakfast, lunch, and dinner. But the consequences that I see, again, being a former GYN, and I still do GYN, and currently managing women's menopause and perimenopause. Now we're on consequences of skipping breakfast and lunch, starting with cycling women. When young women come in to see me and they have heavy periods, irregular periods, painful periods, no periods, infertility, again, do you eat breakfast? Correcting just that straightens out most of their problems. before we get to the content of what they're eating. And in my perimenopausal and menopausal and andropausal patients, we're seeing hot flashes, night sweats, vaginal dryness, difficulty sleeping, mood swings, irritability, depression, anxiety, low sex drive, poor mental clarity, weight gain, joint pain, muscle weakness, headaches, hair loss, and in men, erectile dysfunction. Again, much of it managed very well once they correct that timing of eating. I'm almost finished. The what you're eating is different. I approach it differently than it should be vegetarian, vegan, lacto, ovo, what have you. We get to that eventually. But initially, what I need to find out is, are you eating anything to which you're allergic, sensitive, or intolerant? Because that can lead to inflammation, which will further cause a detriment to your system and make you gain weight. So we do a lot, food allergies, very minor, but food sensitivities is a huge part of what we do to help people try and figure out if they're eating foods that are causing an inflammatory reaction. And that is very individualized because like for me, it's gluten, soy, corn, dairy, and I just realized potatoes, okay? But everybody else is very individualized. Quick note on family history. Most people come in and they say, it's in my genes, I'm overweight because my family is overweight and such. While you may have a genetic predisposition to gaining weight, the thing that you have to do is put those genes in the right environment in order to flourish. And the lifestyle that we learned from our parents is what we're carrying through generation after generation. And that, for the most part, is what is causing what appears to be genetic, where it is not, it's more lifestyle choices and habits. Next slide. So in our practice, of course, because we have an aesthetic practice, we do body contouring. And we can take you from before to the after picture in 2 weeks. But the question is, what are you doing in terms of your lifestyle that can sustain that once we do it? So we're going to make sure first that you're on a good nutrition plan, lifestyle plan, and everything, so that if we have to intervene with our body contouring, it will be sustained. We also have, next slide, physician supervised weight loss programs. And yes, someone asked when before we came on camera, yes, you could lose 10 pounds in 10 days. My patient can lose 20 to 30 pounds in a month, a pound to half a pound a day they can lose. But again, once you lose it, if you go back to the same habits that caused the weight gain in the first place, you'll regain and then some. And then the next slide shows her from the side. So to end, it's not a short-term diet. It's about a long-term lifestyle change. And I'm going to end there so Jane and Elder Clark can continue. Thank you.
Thank you very much. Thank you very much. So Jane?
All right. Can you see this okay?
Yes.
Okay. All right, good. So for those of you who don't know me, my name is Jane Aswari, and I am an integrative health coach. For those who may not be familiar with health coaching, basically what I do is I look at health coaches as a bridge between physician and patient. So you may go to your doctor, and unfortunately with traditional medicine, you may only get 15, 20 minutes with a doctor if you're lucky, unlike Dr. Daly, which is nice. You get an hour, 2 hours with someone, but traditionally you only get, a very short time with your doctor, and your doctor will say, hey, you need to lose weight. You need to get healthier. And patients walk out of the room really not knowing what to do. They know they need to lose weight. They know they need to change their habits. They know things aren't quite right. They don't feel good, but they don't know what to do. And there's so much conflicting information out there. They walk out of the office, kind of feeling lost. And that's where I see health coaches come in, is what we do is we kind of help you get to your goal. And again, each person is different. And we sort of figure out an individualized plan of what works for you, because what works for one person is not necessarily going to work for another. So today I'm going to talk, it's great because I think in today's talk, you're really going to hear about obesity from a lot of different angles. And the angle that I'm going to come from is really more from a metabolic health approach. And if you think about metabolic health, we've heard a lot about metabolic health during the pandemic, right? We've heard those who were not metabolically healthy did not fare as well when it came to, getting COVID. They didn't recover as well. And so, I want to kind of dissect that a little bit more as to what exactly is metabolic health and what does it have to do with obesity. So if you look in a study that's been done, is there's really only 12% of the US population that's actually metabolically healthy. So that's 1 in 8 people. That's not very many. And so that means 88% of us have some type of metabolic imbalance. So what does that look like? What does a metabolic imbalance look like? Well, we tend to think of things like diabetes, fatty liver disease, hyperglycemia, but really at the root of a lot of that is obesity as well, when there's some type of metabolic imbalance. And so, when we have that abdominal, we all have that thing around us that we don't like to see, we don't like squishing it. We want it to go away. Well, that abdominal fat is actually a warning sign that there's some type of metabolic imbalance in your body. So what are there some other warning signs? Okay, well, maybe you have, brain fog, dizziness, anxiety, fatigue. Again, the abdominal obesity is another warning sign. Irritability, you get hangry. It's like when that hunger comes on, it's like you're ready to eat anything in sight. That's really a sign of poor blood glucose control. Maybe you get weak, maybe you get shaky, you might feel a little bit nauseous, you get headaches. Again, these are all signs that there's some type of imbalance going on in your body. And really, this kind of goes along with really what Dr. Daly was saying and showing all those obesity charts. You can see that the obesity epidemic, again, we don't really have the data from prior to that, but you can even see historically, even if you looked at pictures of folks from, pre-1970s, it was very rare that you saw people who were very heavy and overweight. It was kind of like in the 80s, we started to see that creep up. And if you were to plot the same chart of type 2 diabetes, cancer, heart disease, it would follow the same trend as obesity. So what really happened around that time? Again, I think there's a lot of different factors. I'm going to speak more from kind of nutrition and food availability. And so around that time was when the dietary guidelines came into play. And that was like in the early 80s. And, the dietary guidelines really promoted a certain way of eating where we were eating foods that unfortunately, I think, made us hungrier and promoted obesity. And the food industry really capitalized on this. They said, okay, hey, we want to promote, 6 to 11 servings of bread, cereals, rice, and grains. The processed food industry really exploded and started to produce foods for convenience. Hey, this fits into our guidelines of what we want to eat. And so we started to become overfed and undernourished. We ate a lot of food, but we actually weren't getting the nutrients that we needed. And so a big part of the problem is that we tend to eat foods that raise our glucose. So, we most of the time we think of like sugar, sweets. So like, oh, well, you may say to yourself, you know what, I don't really eat much candy, cakes, donuts, that kind of stuff. I'm really good. I stay away from that. And yes, those are higher glycemic foods, but there could be foods that you eat that your body just doesn't react well to. And if we already have some type of metabolic imbalance, our body has even more trouble responding to this. So let's just give an example. So let's just say, the bottom of the chart here, you're at your normal glucose level. Let's say you have let's just pick a breakfast. You have a glass of orange juice and maybe some oatmeal, and you eat that, okay? Because that's a higher concentration of a higher glycemic food, your glucose goes up. When your glucose goes up, a hormone called insulin follows. Insulin's job, and insulin is a life-saving hormone. It's very important to our bodies. Insulin comes in and it says, hey, whoa, wait a minute here. Glucose is really high. High levels of glucose in the blood are dangerous. Our job is to get down, you drive that blood glucose down. So what it does is goes ahead and pulls that extra sugar out of your bloodstream, okay? And your glucose level then comes down. But sometimes our insulin doesn't work great. And what happens is we can actually overcompensate and sometimes become hypoglycemic, where now our blood sugar is too low. So then we start to feel like, you ever get that time, maybe an hour or two after you eat, you're like, I'm starting to feel kind of snacky. I want something to eat again. I'm hungry. Well, then you say, oh, let me have like a granola bar. And so you eat a snack again. The same thing happens. Your glucose goes right back up. Insulin here comes along, tries to drive your glucose back down. And you kind of do this roller coaster all day long of up and down and up and down. Now, insulin is very important because it's got to get that blood glucose down. But insulin also does a bunch of other things. When insulin's around, insulin will tell your body to stop breaking down fat. Because guess what? We just ate all this food. We have all this extra glucose around energy. There's no reason to break down our own body fat because there's energy around. We need to use up what's here. So it stops fat breakdown, stops fat burning, and it stimulates fat storage. So guess what? You have all this extra glucose, right? Well, what's it going to do with the glucose? Well, if you're moving around and doing stuff or exercising, well, sure, then it'll use it up, as energy to supply what you need right away. If you're just kind of sitting around at your desk, like most of us are these days, we're more sedentary, all that energy needs a place to go. Well, if we're not burning it off, then it's going into storage. And so if you think about it, if all day long our glucose is going up, insulin is staying high, constantly stimulating, it's always storing stuff. It's not letting you burn your own body fat, and if anything, it's making more fat. So again, insulin's role in the body is extremely important, but I think one of the things we don't realize is that as we eat, we're constantly stimulating insulin, especially if we're eating higher glycemic foods. And so what we want to do is we want to start eating foods that don't raise our glucose so much, because glucose is stored in one of three places. When that spike comes up, right, that extra glucose can go in one of three ways. It can go into your liver for storage, okay? It can go into your muscles, or it can go into fat tissue, or it can be used right away for expending energy. So I don't know if you've ever heard of non-alcoholic fatty liver disease. So when we have extra glucose around and then it becomes fat storage, it gets stored into the liver. Well, your liver can only hold so much. So when you constantly are creating excess glucose to be stored as excess fat, and the liver has no more room, it's almost like this woman trying to shove everything into the closet. You can only shove so much into the closet before it's full, right? And you need helpers. And maybe you ask your girlfriends to come over and say, hey, I'm having a party and I need to get all the junk that's in the house, out of the way. So I need to shove it in this closet. So you get a couple of friends to come over and try to shove in more. That's what insulin's trying to do. Insulin's trying to help glucose just get shoved in somewhere and stored. But we keep stimulating the insulin all the time because we keep eating things that raise our glucose, and our body's like, there's nowhere left to store stuff. And so your liver becomes so full, and that actually promotes fatty liver. And so again, if you don't have much muscle mass, there's less place to store the excess sugar too. So really, I think doing some weight resistance, it doesn't have to be heavy. You don't have to be a gym rat. You could just do some simple bands, simple weights at home. That building muscle will allow you to have more places for your glucose to be stored. And then ultimately, when muscle's full and liver's full, it goes into fat. And so as we age, we already become more insulin resistant. Our bodies, our insulin doesn't work as well as it used to. And so you figure now we've got all these things against us. We're eating pretty healthy. It doesn't seem to make sense. But then if we're eating foods that raise our insulin all the time, that's why it's so difficult to lose weight, because your body will not burn your body fat as long as insulin's around. So one of the things I, use with all of my clients is something called a continuous glucose monitor. And this is similar to, most people think of checking their blood glucose as like, well, I'm not diabetic. Why do I need to check my blood glucose? And I think this is probably one of the best pieces of information you can get for yourself, because every single person is different. So what I eat and what you eat, let's say we both eat a banana. For some reason, my body does not like bananas. My sugar goes very, very high. It takes a while to come down, and my body doesn't respond well to it. but maybe you can have a banana and that's no problem at all. And so the beauty of wearing one of these is that it actually measures your glucose throughout the day. So you can look at all the different foods you eat and see how your body responds to it. Oh, I didn't realize I eat this and all day long it's doing that. Well, that makes more sense. Oh, I can eat this and actually it doesn't bother me at all. And so really that's when you start to be able to customize what foods make sense for you. What foods are not going to stimulate my glucose and my insulin all day long, so that I can start working on fat burning. So my body can actually use my fat stores for energy instead of creating new storage all the time. And so I'll put a link in the chat after this, but there's a link to a free one of these free monitors that you can go online. You can fill out like a quick little form and get one. The only thing is you still need a prescription from your doctor, but this at least gives you a voucher. So then you can go to the pharmacy with a voucher and a prescription for your doctor for a CGM. And you can get one. It's a 14-day monitor. You stick it on your arm, it connects to your phone, and you can basically see how your glucose is doing. So I find it an extremely valuable tool. And I just want to take a few minutes to just talk about fat in general. So there's really two kinds of fat in our body. There's visceral fat and there's subcutaneous fat. So we all know the subcutaneous fat. That's the fat that's right on your skin. That's like the squishy stuff. You can squeeze it on your body. You can pinch an inch or two. That's subcutaneous fat. So when our body, I talked about before how when the blood sugar goes up, it's got to store it into fat. Well, it can do a couple of different things. So if we have fat cells, the glucose can be stored there. But for some of us, and a lot of this is genetics, some of us have fat cells that they're not stretchy, they don't grow. So when that fat cell gets full of glucose, it can't store anymore. It's kind of like that closet, like you can't fit any more of it. Then you have other folks who have fat cells that can actually expand and grow quite a bit, and they can actually have a lot of glucose storage. So again, there's that's one way that glucose is stored in fat. So then your subcutaneous fat kind of gets bigger and bigger as sugars get stored in there. The other kind of fat is something called visceral fat. That's the fat that gets stored around your organs. That's actually the most dangerous type of fat. So I don't know if you've ever, seen someone who has that, that pot belly where it's really hard. It's not like squishy subcutaneous fat. It's like very, very hard. Like if you were to sort of poke at them, it'd be very difficult to move it. That's visceral fat. That's the fat around the organs. Okay, so when fat cells have no more room and you can't put any more sugar in there, it's going to start making fat and putting it around your organs. So that's what we don't want. So you might see someone and say, hey, that person's thin, they don't have any issues. Well, they could have visceral fat because they don't have much subcutaneous fat. So their body has no other choice but to put it around their organs. So we have to be careful that is, if we think, oh, well, I'm not overweight, that doesn't necessarily mean you're metabolically healthy. You still want to be aware. And, like Dr. Daly said, blood work is extremely important and much more important than the number on the scale, to be honest. Once you figure out what's going on inside, then you can work on the weight. The weight will automatically happen later. We have to heal from the inside out. So TOFI, TOFI, is something called thin on the outside, fat on the inside. And that's the visceral fat I'm talking about. So, I didn't want to just focus on those who have abdominal obesity and that this talk is really just for those folks. We have to be careful because we may have fat inside of us that we don't even realize that could be dangerous as well. For those of you who like to read, I highly recommend a book called The Obesity Code by Dr. Jason Fung. It's an excellent book, but for so many of us, we've all been on the diets. We've yo-yo diet probably for years and years, and we've been taught that, okay, well, if I just eat less calories and I exercise more, then I'm going to lose weight. We go through this cycle of like, well, I eat less, I lose weight, and then you lose it. Your metabolism starts to slow down as a result. And then when you start to eat normal again, you regain the weight and you're like, oh man, I got to eat less again. I got to hit the gym again. And then we kind of go in this cycle and we get nowhere and we just regain the weight and lose the weight, regain the weight and lose the weight. And it's just, we don't understand. And honestly, there's so much bad information out there and that we haven't really been taught what we should do. And so again, I want to tell you that eating less and exercising more is not the answer to losing weight. It's really understanding what's going on inside your body. Is there a hormonal imbalance? Is what's going on? Is it cortisol? Is it, insulin? It's probably a combination of things. Our body doesn't work in isolation. So chances are, if you have hormonal imbalance, probably have insulin issues, insulin resistance, you probably have glucose dysregulation. I'm sure it's a combination of things. So what are some things you can do starting, right away to help improve your metabolic health? One, we have to stop snacking every 2-3 hours. We need to have our meal, eat it 4 or 5 hours later, eat again. Because if we keep eating every 2 hours, we're constantly spiking our insulin and glucose. And so you will not burn any fat. You will not be able to lose weight if you do that. We want to avoid that glucose roller coaster. We need to stop eating foods that make us hungry. And that's really, a lot of it is the processed foods. So if you look at the supermarket, when you go to the grocery store, there's really only a couple of sections that's real food. It's either the produce section, the meat section, the seafood, like fish section, right? That's pretty much it. And they're all on the outer parts. Like you got to walk to get to those sections. Everything in the middle is processed. It's in a box, it's in a bag. It's convenient. And I know we're all busy and they make food so convenient now. You don't even have to do anything. Just pop it in the oven, pop it in the microwave, and so it's not your fault, because we now live in a society where, the food industry has capitalized on all of these things, but you have to realize a lot of those foods are making us hungry and making our glucose spike and making us overweight. The other thing you want to do is, next time you get your blood work done, ask to get a fasting insulin level. 99% of doctors that I talk to do not request a fasting insulin level. So they do your fasting glucose, they do your regular lipid panel. You want a fasting insulin. If your fasting insulin is high now, you can prevent a lot of chronic disease. Insulin is usually a predictor 5 to 10 years ahead of whether or not you're going to get diabetes. So maybe you say, oh, well, my fasting glucose isn't bad, or my HbA1c, which is a diabetes indicator, oh, it's not that high yet. If your insulin's high, it's just a matter of time before prediabetes, diabetes is going to come creeping up. So get your fasting insulin level check. Keep your insulin low. Again, staying off that roller coaster. Get a CGM. It's a great tool. It's if you have to pay out of pocket if you don't have diabetes, your insurance won't cover it, but I believe it's like $40. I mean, I just think it's a great investment for that amount of money. The other thing I would say is remove inflammatory oils. Dr. Daly mentioned inflammation too. It's a huge driver of chronic disease. And especially if we're eating processed foods, you're going to find all these oils in there: canola, soybean, vegetable, cottonseed, corn oil. You got to get those out of your diet. They're inflammatory. They make you hold on to weight. They're causing imbalances. And really, if you make a decision to stop eating processed food, you automatically get rid of a lot of this, because I guarantee you check every bottle of dressing out there, every box of crackers, or every bag of chips, they're all going to have these oils in it. Okay. And then the last thing is eat real food. So if you're not sure, what do I eat? Eat real food. Go to those sections I talked about. Go to the produce section, go to the meat section, go to the fish section. Like, eat real foods, healthy proteins, healthy fats, fruits and vegetables. Okay. And then again, with the CGM, figure out, okay, not every food is for everyone, right? I know whole grains are promoted as healthy, and I'm not saying they're not, but not everyone's body is going to respond well to whole grains. That's where the CGM is great. Okay, you know what? I really can't have whole grain bread. My body doesn't do well, but I can still have, I can have sweet potatoes, that works well, or I can have, legumes, or I can have quinoa, whatever. Again, and some other people might not be able to. And that's the beauty of using a CGM, is to individualize what's going to work best for me, because there is no one diet that fits everyone. And this is where you can customize it for yourself. And again, this is my last slide, is really just focusing on getting metabolically healthy, fixing the imbalances that are going inside, take away the things that are promoting it. Our bodies are so amazingly designed. God has really designed our bodies to be to heal. all we have to do is stop getting in the way. And we keep putting things in our body and creating obstacles to make it harder for our body to heal. So let's just focus on that. Focus on getting metabolically healthy, focus on eating real food again, try to get rid of the stuff that's making us crave and be hungry, and the weight loss will automatically happen. You don't have to fight and worry about getting on that scale each day and getting discouraged because it didn't move the right direction. If you focus on being healthy, the weight loss will come. Thank you.
So I just want to again thank Dr. Sepulveda for her wonderful presentation, very informative. Jane, thank you as well. I think it was a nice compliment and build on Dr. Sepulveda's great presentation. And we're now going to close things out with a presentation from Jermaine Clark.
All right, thank you very much, Doc. And good afternoon to everyone. And for those who are keeping the Sabbath, happy Sabbath to you all. I must say that I really appreciate presentations that went before me, and so much was said that I don't need to repeat, and therefore I'll just endorse. And also the fact that I have just a few minutes because I have a medical missionary training school that is starting in 5 minutes. So I'm gonna just do slides real quickly, just complement what was said by our two previous presenters. And thank you very much, ladies. Wonderful job. All right. The theme that I always use, as you know, health, hope, and healing. All right, let's look at it this way. Just want to make it a lighter, a little more understandable. Now, we believe that there is a very large problem weighing heavily on the hearts and hips of the American people. And it is becoming a worldwide population at large, right? It is a weighty matter of immense proportions that fills the surface with fear and presents excessive food for thought for those who feel that everything around them is bursting at the seams. And we certainly can identify a lot of people in that situation. Now, also, we find that grossly overloaded with excess baggage, men, women, and children of all ranks, classes, and dimensions load their guns with the artillery fire of diets and fads, only to find that they are bombarded with round after round and pound after pound. And we find that to be true. And it was also mentioned that these fad diets, they're not sustainable. And what we try to promote is a lifestyle change. We believe that that is more sustainable if we make changes that are permanent, not going on these yo-yo diets. Now, it is a strange battle where the only winners, watch this now, the only winners are losers, and losers have nothing to gain. And so if you look at the picture there, you get the concept of what I'm trying to say here. The numbers of the scale reveal that casualties are high, especially among deserters, those who like to snack, as was just mentioned. This appears to be due to the fact that as one shifts his weight in an effort to retreat, he discovers that the battle is being fought in both fronts. By that I mean the pot belly and then hanging on the hips in the back. And so that's where the battle is being waged. The battles or the battleships used in this war are like the Titanic, whose superfluous frame was built to exceed the manufacturer's specifications. Those who consider themselves unsinkable due to excessive flotation reinforcement finally realize that the bigger we are, the harder we fall. And we can all conclude with that being true. And we see some of the examples there on the screen. Now, I want to say also, if you think your chances of becoming fat-free are pretty slim, think again, okay? If you think there's no hope and that you cannot do it, think again. You see, the greatest medical book that has ever been written tells us this, that I can do all things through Christ, which strengthens me. And I believe that wholeheartedly. And so this epidemic of obesity can be won. See, what I find is that wisdom is better than weapons of war. And God's plan is to educate, whereas man's plan is to medicate. And I want to subscribe to God's plan all the time. I'm not saying there's not a time for medication, but I believe that the more we know, as it always said on NBC, the more we know, I believe that is empowering as we are trying to do this evening in giving you information. I also believe, and I've often said this to you, every disease has a cause. And according to the wise men in that great medical book, the curse causeless shall not come. The curse causeless shall not come. Also, what Job decided to do is to search out the cause. What is causing this overweight, this obesity? Because there is a cause for that curse. And oftentimes, as was mentioned, that can be attributed to diet, lack of exercise, poor lifestyle habits. These are factors. It was also mentioned, and I believe this to be true, and thank you, ladies, for, like I said, I'm just complimenting what you said. Heredity loads the gun, lifestyle pulls the trigger. We may be having predispositions, but doesn't mean that we have to be obese or have diabetes or end up with colon cancer as maybe a grandfather did. Obesity, in this context, it is not that we have a destiny with some of these diseases. Lifestyle pulls the trigger. And so if we make the lifestyle changes, we certainly can reverse disease processes. When we talk about obesity, was mentioned, there's some of these complications that we suffer from. So it's not just being overweight, that is the main concern, but the fact that it causes pulmonary diseases and liver diseases and also gallbladder disease and then stroke, cancer, heart disease, and the list goes on. And Jane was talking about the metabolic imbalances with glucose leading to diabetes. And so you'll find that oftentimes there comes a vicious cycle where we're going in rounds and rounds and rounds all the time. What I want to do in the next couple of minutes is just to share with you God's plan, winning the battle of the bulge. God's plan, winning the battle of the bulge. And I've always mentioned these 8 laws, and I believe that they are applicable to every type of disease that you may encounter. These are the 8 doctors that make house calls: godly trust, open air, daily exercise, sunshine, proper rest, loss of water, always temperate, and nutrition. Now, for the sake of time, I cannot go through all of these laws. I'm just going to focus maybe on 2 of them so that we can see from a certain perspective why a violation of one of these laws will result in obesity. I believe, ladies and gentlemen, that God's plan is for the preservation and restoration of health. So let's talk about the first law. I'll focus on this one and then nutrition. See, godly trust. Now, it has been established and was mentioned that stress is a culprit for a lot of the diseases that we're suffering from. Now, we believe that godly trust is the antidote for stress, which causes an increase in blood cortisol levels. And so when we have an increase in blood cortisol levels, as Jane was just talking about, visceral fat. If you see on the screen, we end up having insulin resistance, can get the insulin into the cells so that the glucose can be out of the bloodstream. And then you have fat accumulating around the organs, and that's visceral fat. And this is one of the serious problems that we are encountering. And so we just want to be mindful of that. Let me also say this: the mind affects the body. And this is a known fact. The mind affects the body. If we're stressed, or there is that fight or flight response to this dog jumping out at you, or you being sideswiped, or you're being come at from different angles at work, here are some of the things that happens to our bodies. There's an increase in our heart rate, increased breathing, blood vessels constrict, blood fats increase, immune system weakened, digestion stops, more nutrients used up and less waste removed. And a lot of times there's so much waste accumulating in the body. I believe it was said that it's about getting rid of a lot of the waste that is in our bodies. So let's keep that in mind, that stress shuts down our digestive system. Therefore, you may be eating vegan foods, but not getting the benefit from the foods that you're eating because it is not digesting properly. So what we do find also is that here's some, like 5, just 5. intensifies hunger and cravings. So stress causes us to be hungry more. And what do? We keep eating. It was just mentioned not to snack, not to be eating every 2 hours. And oftentimes what we do, we eat all through the day. Some people, they eat 1 meal per day, meaning they never stop eating. Brothers and sisters, we have to be mindful that we should have hours between each meal. It was mentioned 4 to 5 hours between meals. Also, it slows metabolism by suppressing the thyroid production. It drains our energy, so we're tired and we don't want to work out. We can't be bothered with exercising, interferes with sleep, and also it causes us to not having a brain fog, as was mentioned. But we do find also that stress can lead to weight loss. Now you may ask, how is that possible? Well, the thing is that the fight or flight response can activate and speed up metabolism. But also then we have hyperstimulation from the fight or flight that can affect the gastrointestinal discomfort. And so what it leads to is, I don't feel like eating. I don't like how I feel when I eat. And so there is a loss of desire to eat, and therefore we're not getting the nutrients and the calories that we need. And so we can lose weight as a result of being stressed. So what we're looking at is weight management. We can gain weight from being stressed, and we can lose weight from being stressed. And therefore, it's a healthy lifestyle that needs to be promoted. Also, we find that when we lose that desire, the mind becomes very consumed with the stress or the stressors in our lives, and we have no desire. We may forget to eat. And then the loss of sleep, the cortisol impacts metabolism, as was just mentioned. Let me just mention also depression can lead to weight gain and weight loss. And especially during this pandemic era, so many people are depressed. Therefore, what I'd like to suggest to us is that godly trust, that law, if we put our faith in Him, it is the antidote for stress. Did you hear me? It is the antidote for stress, casting all your cares upon Him. Here's what the Bible says, that great medical book: no temptation has overtaken you except that is common to mankind. God is faithful. He will not let you be tempted beyond what you can bear, meaning that nice pepperoni pizza that some people eat, or the donuts, or the milkshake. God will not allow you to be tempted beyond what you can handle. Therefore, He will, with the temptation, provide a way of escape for you. So my brothers and sisters, those who are struggling with the foods that you're eating, not being able to say no to certain foods, God has the power to give you the strength. And therefore, trust in the Lord with all your heart. Do not depend on your own understanding. Seek His will in all you do, and He will show you the right path. Quickly, lack of fresh air retards digestion. We mentioned exercise helps us lose fat. We spoke about going to bed at a certain time and not eating too close to bedtime, because that also packs on the pounds. Being temperate, the choices that we're making, not everything is good for eating. We have to make wiser choices, and we must start with our children. We must encourage our children to eat healthy, eat the fruits and the vegetables, and not always eating the fries and the burgers. Also, hidden sugars, look for those, and the refined products, as was mentioned, they're all over the supermarkets. The healthy stuff is in a little corner and it's more expensive, so it discourages you from purchasing it. But we must realize that the greatest machinery ever built was this human body. In fact, I call it Creator's masterpiece. Why not put everything we have in protecting and preserving our health? We do that for our cars, we do that for our homes, but this living machinery is our most prized possession. And so when we talk about eating right, we must realize that death is 3/5 what we eat. This last thing I say to you, Ecclesiastes 10:70 in the medical book says, thy princes eat in due season, meaning there's a time to eat. Hello. And there's a reason for eating, which is strength, and not for drunkenness, which is the amount and the combinations. Too many times we eat too many things together, or the quantity is too much, and therefore we are drunk, or that leads to disease processes. And so when we're eating, we should eat at the appropriate time, and there's a reason for eating. I call the type of diet that is encouraged here the glad diet, the God's life activating diet. And we need to make a transition from the SAD diet to the GLAD diet, the standard American diet to the God's life activating diet. You see, the standard American diet is high in fat, high in protein, low in fiber, and low in nutrients, whereas the GLAD diet is low in fat, low in protein, high in fiber, and high in nutrients. Now, my time has run out, but here's the last thought, the fence or the ambulance. We have to make a decision. I can't get into the story, but research this story, the fence or the ambulance, because what I find is the cure is in the cause. Did you hear me? The cure is in the cause. Making the right choices can result in disease reversal, and therefore we can cure ourselves by making certain lifestyle choices. Sorry, I have to run, but may God bless you all.
Thank you, Elder. Thank you, Elder Clark. Really appreciate your presentation and your participation as always. Again, I just want to thank not just Elder Clark, but Dr. Sepulveda, as well as Jane, for their presentations. All very wonderful, all very informative. Audience, we gave you a lot of information, and I know you also came with your own set of questions. So if you would like to ask your question, please raise your hand. We'll see it, or you can put it in the chat, and we will put it to Dr. Sepulveda or to Jane Aswari.
Elder Dulles, while we're waiting for the questions to come, I have one.
Yes.
Where does water impact the presentation with regards to the weight loss? How, I should say, not where, but how.
I guess Jane and I can answer that question. I mean, typically what we say is that unless you have some type of cardiovascular disease like congestive heart failure or something like that, where you're restricted in terms of the amount of fluid that you should intake, you know, your doctor would have told you that, drinking half your weight in water is ideal. So, you know, drinking water, of course, helps the body, you know, flush out impurities, what have you. We are 70% of water. We sweat even when we talk, we're losing water. Even at rest, we're losing water just by breathing, walking around. And, you know, in a regular day, we need to replace that which we are losing to keep homeostasis. So drinking water is very important. And it's amazing how many people don't drink water, because people say, I don't like the taste of water. We've lost our taste for that which is tasteless because we've overwhelmed our taste buds with so much sweet and so much sugar that we have to reacclimate ourselves to enjoying the taste of water. Now, for my patients who just cannot stomach the taste of water, you know, okay, you could add a little lemon to your water. You could add things to flavor it that won't sweeten it, because that's what they want to do is, can I add sugar? Can I add honey? No, you know, but, you know, you can do some things to enhance the flavor of water. So you're drinking half your weight in water. So that's ideal. And you will reacclimate that taste for it. A lot of people say, well, I can't drink water because I'm a teacher and I don't want to have to go to the bathroom all day, or I'm a nurse and I don't get breaks and all of that. The more you drink water, your bladder eventually should get accustomed to holding that water, that urine, so that you don't have to keep running all the time to the bathroom. But again, you have to train your body again, because it's very essential that we do intake a certain amount of water every day.
And
So
how much does water weigh? So those who want to calculate half their body weight.
Half your weight
if
in
I weigh
water.
200, I need to drink 100 pounds of water a day.
Ounces of water.
Okay,
Yeah.
okay, because that was,
Yeah.
I said, that's a lot of water.
It is. It
Ounces.
is.
All right.
Yeah, it is. Yes, yes.
Jane, what would you add to
Mhm.
that?
No, I think actually she covered everything I was going to say. I was also saying about half of your weight in ounces. And I think one way to get that water in is as soon as you wake up, drink a cup of water. right? And then make it a goal for yourself. Okay, by lunchtime, I want to have at least, have had maybe 2-3 glasses. And if you sort of break it up in the day, it's a little bit easier to accomplish than by the evening time you come home from work, you're like, oh man, I hardly drank any water. Then you're trying to guzzle, that much water. It's difficult. So I always tell people, definitely drink as much as you can earlier in the day. And I think it makes it easier to accomplish that. And then, cucumbers, some people add some berries into their water if they really can't handle the taste in order to get used to it. But I agree that our taste buds have changed so much that we can't appreciate just a clean taste anymore, which is water. So,
Right.
but you can do it over time. And again, I wouldn't, like, let's say you're only drinking 1 or 2 cups today. Don't go to half your body weight tomorrow. You won't feel well. So over time, gradually increase that amount of water. I always carry my water with me everywhere. So having just a bottle with you all the time just is a reminder. Have it sitting on your desk, to just constantly look at it and drink, and that will help.
Right. Definitely.
Makeda, go ahead and unmute and ask your question.
Yes, I have a question. So 2 questions. Is there anything wrong with ice cold water? And the second question is, is it okay to substitute some of your water with, I guess, like fruits or vegetables maybe that are high in water? Because I've heard that, and I just want to know how true it is.
So the amount of water you take in a day can come from a combination of your food and what you're drinking. It doesn't have to be only water. So in that case, you can have, you can count, like people say, well, can I drink tea? Can I drink other things? Yeah, those can count towards your liquid content as well. As for whether ice water is bad, I think there's different people who might have different opinions on that. What our internal temperature is not ice cold. So the thing is, when you drink ice cold water, your body has to manage that, right? And so it's a little more work for your body to bring it to the right temperature so that it can deal with it. So it's not so much that you'll get sick over time or something like that from drinking cold water. It's just, your body's just not used to it. So it has to do a little bit more work to utilize it. I don't know if you want to add anything, Dr. Daly, to that.
Not really, other than with the ice cold water, there are some people who cannot drink water unless it's ice cold. But those people, I have noticed, tend to drink less water. If water is room temperature, most people are able to intake a lot more at a time than when it's ice cold. But then there are others who, if it's not ice cold, they just can't handle it. So, I relent at that point and just hope that they can get in as much as they can. And, yeah.
We'd rather them drink ice cold than not drink. So if that's what's
right,
going to
exactly.
make them, if that's what's going to make them drink water, then that's fine.
That's right, exactly, yes.
So there's a question from Chris Campbell. I don't know, Chris, if you want to ask it directly, but I see that in the chat, you're asking for us to comment on intermittent fasting.
Yes, Elder Horace, that is correct. What is intermittent fasting, and then what are the benefits to intermittent fasting?
Or even the risks, if there are any.
Or if there's a risk, yes. All of that. Thank you.
Okay, if you don't mind. So when it comes to intermittent fasting, for those people who don't know, a few years ago, they did studies on what is the impact on the human body, basically, when we restrict calories for a certain number of hours versus eating all the live long day. Those were the first studies that were done. And the first studies that were done showed that restricting calories was better. And we jumped on that with this trend called intermittent fasting. And no, intermittent fasting actually dates way back, okay, to the time of Egypt and all of that. But more lately, it's been researched because of some research that had been done. So what the average person is doing, my patients, okay, not everyone, when it comes to intermittent fasting is they're restricting calories for anywhere from like 12, 14, 16 hours in the day. And what they typically do is they go to sleep and then or their last meal is whenever, and then they don't eat usually until 12, 1, 2 o'clock in the afternoon, because that will be their 14, 16 or whatever hours. And then they eat maybe 1 or 2 meals and then they go like that. And initially, again, the studies had shown that there was improvement in metabolism and there was, decrease in blood sugars and all these different things. Weight, of course, that everyone jumped on it because of weight loss that people were seeing. And I can tell, all I can say is I can tell when my patients start intermittently fasting, I know right away, because we're doing blood sugar, we're doing blood work all the time. And I see blood pressures going up, cholesterol going up, and they start regaining weight. And I know right away, I say, are you intermittently fasting? Because that's not what we talked about. And they say, oh, yes, I met my trainer, told me to do this and that. And I said, okay, well, this is the trend. Look and see what's happening, okay? And the reason we're doing it this way is because it goes with the lifestyle that we have developed in the Western Hemisphere of not eating breakfast. So, I don't eat breakfast anyway. I don't want to eat breakfast. So I'm just going to do this intermittent fasting thing there. And even though I'm against intermittent fasting, I'm going to say something that's going to sound paradoxical. Your body was designed to intermittently fast overnight. Okay, that's when our body was designed to intermittently fast, because during the overnight fast, your body repairs and heals and detoxes and grows. And that's what it happens during the overnight fast. So what I see happening, and I'm sorry if this is taking a while, but ordinarily, we have cortisol that is high in the morning and comes down by midnight, right? That's the circadian rhythm of your adrenal gland. If it's high in the morning and then it comes down by midnight, that means while you were sleeping, 2, 3, 4 o'clock in the morning, cortisol went up. That's the normal circadian rhythm of cortisol. So why does your body need your adrenal gland to create cortisol at 2, 3, 4 o'clock in the morning? It needs energy. You're detoxing. Cortisol leaves the adrenal gland, liberates glycogen from the liver, and causes gluconeogenesis, which is a stored form of sugar, so that your body can do what it needs to do while you're sleeping, doing that important job of detoxing you. Come morning, prayerfully, you have breakfast, lunch, dinner, and cortisol goes down. 2 major reasons cortisol may spike: miss breakfast or lunch, and number 2, stress. All right. So eventually, we see this flattening of the curve with our patients, and now they have adrenal insufficiency. So if your cortisol is low in the morning and your cortisol is low at night, which is what we're seeing with adrenal, I forget the name of it, dysfunction, basically, insufficiency, what is going to happen at 2, 3, 4 o'clock in the morning? Cortisol is down in the morning, which means it did not rise while you were sleeping. And we're seeing this trend with our patients, right? Come 2, 3, 4 o'clock in the morning, your body says, hey, I'm detoxing. Where's my cortisol? The adrenal gland says she hasn't had cortisol in a decade. Boom, you get a shot of adrenaline. And you get these spikes of adrenaline all through the morning. It wakes you up, it makes you hot, it makes you anxious. You have to go to the bathroom to empty your bladder, and it shuts down your digestive tract. Like Jermaine Clark had just said, cortisol shuts down your digestion. So you wake up in the morning, now you're not hungry because you just had these adrenaline surges. And we keep self-perpetuating this cycle of not eating breakfast, not detoxing well, and waking up not hungry and continuing to do that. So the way to break the cycle is you have to eat breakfast within an hour or 2 of waking up. And think of it another way. You go from dead asleep to fully awake. You need calories to get you ready for the day, and we give the body nothing. And we expect that it will function normally. Lunchtime, the busiest time of the day, we give the body nothing, and we expect that it will function normally. So people don't understand when I'm telling them that all of their hormonal and metabolic and partially is due to the fact that they don't eat breakfast. They say, well, I haven't eaten breakfast since middle school. And for most women, it started in middle school. And I say, yes, it's come to a head now where it's a problem because your ovaries have shut down and you have all these shifts going on. And this is an issue for women and men. So I the latest studies on intermittent fasting is showing, yes, intermittent fasting still is good overnight. If you restrict calories overnight, you're keeping with your body's circadian rhythm, and that is proving now in multiple studies to be better than restricting calories in the morning. That's what I have to say about this.
Okay. All right.
So
So Jane,
add one thing.
Jane, why don't you give your perspective?
Yes.
I won't take a lot of time because I know we don't have a lot of time left. The only thing I would like to just say is that I think it differs for every person. So I don't know if we can have necessarily blanket say intermittent fasting is not good for everyone. I think like a postmenopausal woman, you know, would have a different experience intermittent fasting than let's say a, you know, 40-year-old diabetic man. You know, so I think that there's going to be differences in that. The one thing with calorie restriction and intermittent fasting. So, you know, the traditional thing is that we're eating all day long, right? Every 2 hours we're eating. When you eat in a restricted window, let's just say you eat from like 12 p.m. to 6 p.m. If you actually just focus on eating your regular 2 meals, you probably can get in the same amount of calories you would have eaten if you had eaten from 8 a.m. to 6 p.m. So I don't want to necessarily say that. I just think everyone's unique. There's bio-individuality, there's genetic predispositions. I do think for those who have prediabetes, diabetes, insulin resistance, I do think there's a place for intermittent fasting. And so, you know, I know Dr. Daly and I are a little bit on a different page with this particular topic, but, you know, so I would just say, I think you would need to find out for yourself if that's a protocol that would work for you, because it may or may not. It may cause, you know, yes, intermittent fasting can be a stress on the body because you're not eating, but there's also, it's called a hermetic stress. It's a good type of stress. It's like exercise. Exercise is stress on your body as well, but it's a good type of stress. You know, fasting can be looked at that way too. Again, I think it does depend on the person, what your starting point is. If you already have really, you know, you have deficient adrenal function already, or you may already have a significant hormonal imbalance, fasting right off the bat probably isn't the best idea. But you know, what is your starting point? I think that's important to note as well as whether or not it would be beneficial for you.
I just want to say something else, that intermittent fasting for the short term to reset your metabolism, to make certain changes, to get away from your dependence on eating all the time. For short term, I don't have a problem. I think intermittent fasting becomes a problem when we try to make it, I mean, in terms of restricting calories in the daytime, when we try to make it a lifestyle. It definitely, you know, goes against that, again, that normal circadian rhythm, and eventually it will catch up. Like I said, I have patients who have been, quote, intermittently fasting from middle school. Now in menopause, it's becoming a problem because that's the lifestyle that they've carried on. So I think eventually it will catch up with you. But if you're doing it for a short term, it's like prayer and fasting. We know that that's very beneficial for the body to restrict calories. The Muslims do Ramadan for a whole month, very beneficial for them, but it's not a lifestyle. And I think that's the problem, is that there are definitely proper, I don't want to say proper, but ways of eating that goes with your normal physiology that we should be learning, that that's what we should be gravitating towards. So that's my take on it. Not to say that you absolutely should never do it, but don't make a lifestyle out of it. Okay.
Great.
Elder,
Thank you.
we've been waiting. There's one who's been waiting with her hand up, Kelly.
Yeah.
And go ahead and unmute
Kelly.
her.
Yeah. Kelly, go ahead and ask your question.
Thank you. So, Dr. Daly, you had mentioned earlier in your presentation that breakfast should be eaten within 1 to 2 hours of waking. What about people who do exercise daily? Do you recommend, you know, if they wake up and, you know, you have your devotion time, maybe you exercise, then you eat breakfast, but that might be a little more than that 1 or 2 hour window. What are your recommendations? Because I've heard that it's better to exercise in a fasted state. Is, you know, do you agree with that, or do you have alternative advice?
Okay. So you're waking up at what time typically?
Well, let's just go with the general population because I'm a late sleeper.
Okay, yes, yes.
I sent you a private chat because I would actually love to talk with you, but I'm in Tampa, so I would have to do like a
Okay,
video
no problem.
appointment.
Okay.
But yeah, I'm just curious your general answer because I've heard that breakfast is just your first meal after you've been fasting overnight, right? But you're saying no, breakfast is actually timed within waking up because it's this circadian rhythm that you're following. So
Right.
where does exercise come into play?
So what I usually recommend my patients to do, because again, most of them don't have the appetite to eat because their digestive tract has been shut down overnight because of all of these adrenaline surges. So I usually have them start with, I mean, I don't like the concept of a protein shake. I prefer that we chew our, God gave us teeth, you know, and all of that.
Mhm.
But if you can do a good vegan protein shake prior to working out, that would be better. I mean, then your body has more to work with when you're working out. Because again, the idea of working out is not just to lose weight. You want to build muscle, you want to metabolize better, you know, so that's what I usually recommend. And it doesn't have to be the full protein shake, just something to start within that hour or two. And then you could finish the protein shake after you work out to like what we call a recovery shake after that, you know, or eat after that, you know. So that's usually my recommendation.
Thank you for that. And if you're able to maybe share your information afterwards in the chat or something, I would love to connect with you.
Oh, thank you. Yes, I will. Thank you.
Thanks.
You're welcome.
Here's a question to both of you. What about folks who work nights or do shift work? You know, you know, they work for the fire department, so you know they're 4 days on, then 3 days off, and then when they're on again, it's actually a different time. So they, when they come back, it's during the day. The next time they're at night. So it's not just kind of working nights, but it's shifting all the time. So, I mean, what do you say to, or how do you help folks like that try to create the kind of, I guess, balance and order to their eating and to their overall lifestyle?
Very, very, very individualized. I mean, we have to sit down sometimes and go week to week with you, you know, how to manage, you know, your eating and all of that. Because let's say it's just night shift. When you wake up to start your night, that is breakfast. It's when most people are, you know, coming home, you know, because that's the start of your day. That is breakfast. Lunch is while you're at work. Dinner is that small meal. And usually I say 40% at breakfast or 50% at breakfast, 40% at lunch, 10% at night, right? That's usually the estimate that I give people. So when you're getting up to go to work for that night shift, that's breakfast. Lunch is while you're at work. Dinner is going to be either still while you're at work, that 10%, or when you've come home, you know? And of course, when you come home, that's everybody else's breakfast. And then you're not doing night shift every day. Maybe you're off on the weekend. Now you're swinging back to a day schedule. And it does get a bit hectic, which is why we say night shift and swing shift is for the youth. Sorry. But it's hard as we get older to regulate that type of you know, that type of lifestyle. But that's what I have to do. I have to, you know, sit down with you and work it out, sometimes week to week, you know.
Gotcha. Jane, what about you and your clients?
Yeah, that's tricky. Night shift work is very, very difficult. Because there's so many other factors involved. It's the sleep deprivation, it's your circadian rhythms off. So that makes it hard. But I would agree with Dr. Daly that it really does have to be individualized, looking at their entire schedule, you know, planning from day to day, what's going to work best. Also talking to them about how they feel. Because we may say, hey, you should eat at this time, but their bodies just aren't ready to eat, you know, because there's lack of sleep going on. And so it's hard to give one blanket answer, but you know, ideally, yeah, you want to eat in the hours that your work day and try to keep as much of a normal schedule, just kind of flipped during the night as opposed to during the day. It's especially hard if people are doing multiple things. So it's almost easier if you're always night shift than if you're sometimes night and sometimes day.
Right.
That's really where it makes it hard, because it's like, it's constantly changing. So sorry, there's no great one answer, unfortunately.
There's a question again about what you do during the fasting. What about exercising? So you wake up. Is it good to exercise during your fasting period? Let's say after. So you haven't eaten all night. You wake up. I think you talked about eating or having the breakfast within 1 hour. But what about doing exercise first before eating?
I mean, from my standpoint, I think if you have good glycemic control, then exercising in a fasted state is not going to be an issue. If you have poor glycemic control, then you might get lightheaded, you might get a little bit dizzy if you have not eaten first. So that would be, I don't think there's anything wrong with exercising in a fasted state. If anything, you'll actually burn more of your body fat by exercising in a fasted state, because overnight, most of your glycogen stores empties out. If you have fasted overnight, a good amount of your glycogen in your liver is going to be empty. And then as you're exercising, you're going to be emptying out your glycogen and glucose storage in your muscles. So it really is great in terms of being able to burn more fat. But again, if your glucose control isn't very good, then you could run into some problems. So, and that's where, like I said, those CGM monitors come in great, because then you could see how your body's doing. You can measure before you exercise and say, whoa, no wonder I feel kind of lightheaded. It's because my glucose is way down. For those folks, until they get into a better place, they may need to eat a little bit before they exercise.
Mm-hmm. Yep. I agree.
Okay. All right.
Mm-hmm.
We're a little bit over. I know we went a little long on the presentation, so I want to make sure that we've given everybody the opportunity to ask their questions. So I'm hearing one common theme, which is the goal is not a certain weight, it's a certain lifestyle. It's a certain way of living. So I'm going to let you guys have the final word on that. Either one of you can say anything, or both of you can say just something about what the ultimate goal is when it comes to achieving a good weight.
I think, over time, we've always looked at diets as ways of losing weight, but diets have a starting point and an end point, right? You get on a diet because you're like, oh, I want to fit into this dress for this wedding, or I'm going on vacation and I want to look a certain way. And the problem is, as soon as that's over, we're back to our old behaviors. And there's so much involved that we didn't even get into: emotional eating, stress, all these other things that really compound the issue of obesity and weight. But really, if we focus on small changes every day, what we do on a daily basis is what's going to make bigger changes in the long run. So don't think about like, okay, my goal is to lose 20 pounds this month. I'm going to go to the gym every day. I'm going to do this. No. Make small changes. Let me make this next meal I eat a nice, whole, nutritious meal. Let me get to bed just a little bit earlier tonight. Just do those little things each and every day. That's what builds a lifestyle. That's what's going to make it sustainable. That's what's going to ultimately help you lose weight and get into a healthier state of mind and body. So really, it is a lifestyle change. You have to look at it as a journey, not as a diet, because diets will fail. That's my comments.
Thank you very much. I definitely agree with that. And, one of the things that someone told me when I said that I was going to get into weight loss or weight management, she said to me, that's one of the toughest things that you will ever do. And I thought, yeah, I did OBGYN, you don't understand. But yes, it is one of the toughest things to manage, not just because, we as practitioners, we sometimes we own your victories and we own your defeats, right? And a lot of times it's so heartbreaking to see someone who is doing their very best and making great strides and then be sabotaged by so-called friends and so-called well-meaning family members. And, you know, this is one of the things that I would say on your journey, you know, you be selfish about what your goals are for you and own them and stick with them and understand that not everyone is going to be happy with you making these strides to become healthy. And that's one of the toughest things that I would say that patients encounter, and one of the most common reasons that they end up failing, the lack of support. And but if you go into it understanding that this is what I'm doing for me, okay? I understand that I may be sabotaged. I may be talked down by my friends because we're all the same size. And now I'm becoming slimmer, it's a problem. You know, sometimes we don't like to talk about this, but sometimes hubby or wifey may not like that you're becoming slim, okay? And the process is sabotaged. And this is the toughest thing that I have to deal with patients, is helping them own the process for them. This is about your health, your wellness. And, you know, so I agree definitely with everything Jane said. Small steps, you know, don't feel defeated when you fall off the wagon. You know, it's going to happen. You know, from time to time, you're going to open that bag of chips. You're going to drink that juice that you weren't supposed to. You're going to not drink. You're going to not exercise. But don't beat yourself up. Say, okay, I did this today, but tomorrow is a new day. I'm going to get back on board. Okay. And just be mindful that this is for you. You're not doing it for anyone else but you. That's what I have to say.
Okay. Is it okay to drink water? Is it okay while working at night to drink a lot of water? And I guess the answer is sure, why not, right?
Yes.
Yeah. It feels like there are some issues we didn't get to, and maybe we'll come back in another session. I think particularly some of the emotional pieces, the emotional eating, the issues of childhood trauma or other life trauma, and how we manage that. I think there may be some specific issues about certain diets that we didn't touch on. So I think there may be opportunities for us to come back and kind of close this out, round this out. But I really want to thank Dr. Daly. Thank you very much. Great presentation.
Thank you.
Jane, thank you so much again, as always, for supporting us. Wonderful presentation. Jermaine, you're not here, but we want to thank you in your absence. Appreciate again your continued support and participation. So again, my sincere thanks to all three of you. My thanks to the audience for your presence. We are definitely going to make this presentation and the others available. They're going to be on our YouTube channel. We just had some issues in terms of getting them up, but definitely this information will be up. The presentations will be up, and we will alert you to when they are and how you can access them. So thank you for your patience around that. But again, thank you for your attendance and for your questions. And with that, Pastor, I'm going to turn things back over to you to close things out.
Thank you. And thank you, Dr. Simple Daly. Thank you, Sister Jane Oswari. Thank you, Elder Jermaine Clark. And thank you, all of you, for tuning in. Stay tuned for part 2. I think it is definitely very important. And thank you, Elder DeLisser, for your moderating. Let us pray. Eternal Father, we're just grateful for the time together, and we ask that as we consider 3 John 2, where you say, I wish above all things you prosper and be in health, even as your soul prospers, that in this understanding of the necessity of weight loss and managing our weight and all that goes with it, that it might be to our benefit and to glorify you. Bless us and our families as we enter this new week, and dismiss us with your benediction of peace, we ask in Jesus' name.
Amen. So Jaden, Camille, and Pastor, could you stay on for a quick debrief? Good night, everybody.
Good night. Thank you.
Night. Welcome.
Thank you.
Good night.
Thank you.
Um,
No, they're there.
One second.